Bismillahirrahmanirrahim, dear friends. Today the topic of our discussion is hemostasis. So when there is a vascular endothelial injury, there is exposure of subendothelial collagen. So when there is exposure of subendothelial collagen, what happens? The von Willebrand factor that is in the blood bind with subendothelial collagen. So when von Willebrand factor binds, the platelets that is present in the blood also bind with the von Willebrand factor through a receptor G1B receptor, glycoprotein 1B receptor. And when the binding of von Willebrand and platelet occurs, so the platelet release the two things. One is thromboxane A2 and the second is ADP. What is the function of ADP? ADP expresses glycoprotein 2B and 3A receptor on the platelet. And what is the function of thromboxane A2? Thromboxane A2 causes platelet aggregation on the endothelial angle area. So when ADP expresses glycoprotein 2B3A receptor on the platelets, so it binds with the another platelet. It binds through this receptor with another platelet, and there is a weak linker molecule which is called fibrinogen is formed. So this is a weak plug that is formed in the primary hemostasis. Now to stabilize this weak plug that is formed in the primary hemostasis, we require secondary hemostasis, which strengthen this weak plug and convert fibrinogen into fibrin, which is a strong platelet plug. So in secondary hemostasis, there are factors involved in this hemostasis, and there are two pathways. One is extrinsic pathway and one is intrinsic pathway. So we start from this, starting from the common pathway, which involve factor 2, factor 5, factor 10. So how to remember the common pathway? For remembering purpose, we have made a mnemonic like that. From two, there are two pathways. How to remember? Two pathways, and in this pathway we have to make the clot. So in word clot there are 5 letters, CLOTS. In word clots there are 5 letters, CLOTS. So now when we multiply 2 with 5, that is equal to 10. That is equal to 10. So this is a common pathway. Now we move toward extrinsic pathway. When 2 plus 5, so it's equal to 7. So this was extrinsic pathway. 2, 5, 10, 7. This is extrinsic pathway. And remaining from this 8, 9, 11 and 12. This is intrinsic pathway. Intrinsic pathway, extrinsic pathway. So we've now starting from extrinsic pathway. So how to check the activity of these factors? We require PT. We require PT, and anticoagulant required to inhibit these extrinsic pathway factors, which is 2, 5, 10, 7 is warfarin. So how to remember this? This is by a mnemonic WEPT. W for warfarin, E for extrinsic pathway, and PT for prothrombin. Now we move toward intrinsic pathway. In intrinsic pathway, to check the activity of these factors 12, 11, 9, 8, 10, 5, 2, we require PTT. Is there are more letter in word PTT than PT. So and there are more factor on this. So PTT and heparin require to is an anticoagulant to inhibit these factor. So this was a secondary hemostasis.